Hi everyone, this is Mirna here, and today I wanted to talk a little bit about when should you consider therapy or coaching or both if you are experiencing burnout. So, I wanted to do this video because even as a therapist, so I've been a psychologist for over 20 years, and I definitely hear and see a lot of chatter on LinkedIn and so forth, a little bit of a confusion about coaching from mental health professionals. So, not only a little bit of confusion, but also a little bit of judgment as well. And then also, now that I'm also a certified professional coach, I want to make sure that I help prospective clients, the broader community, and also fellow coaches in our community to really understand when does it make sense to refer out to a mental health provider versus when does it make more sense to continue the coaching relationship. And then I also want to say a few words as to when would it make sense for a client to work with both a therapist and a coach, because there are times when it's absolutely appropriate. So let's start with therapy. So, again, I've been a clinical psychologist for over 20 years, and I am pretty clear as to when it is beneficial for someone to first speak with a mental health provider. And it could be a psychologist, it could be a licensed clinical social worker, a licensed professional counselor, a licensed marriage and family therapist. I mean, there's so many types of mental health professionals. So already things can get muddy quite quickly. But in general, if you're experiencing burnout and we're really talking about significant symptoms that feel and look like depression, any of the various anxiety conditions out there, and so forth. So, in general, we're really talking about clinical disorders. So, these are diagnosable clinical conditions that include what I just said. So, basically, we're talking about experiences in which they have been chronic. So, at minimum, let's just talk about depression for now. If at minimum you're experiencing a number of symptoms for at least 2 weeks or more, then you would probably meet the criteria for a depressive disorder diagnosis. So I'm not going to get into all the nitty gritty of diagnosing itself, but if you've ever been depressed or have questioned if what you're experiencing is depression, you are already ahead of the game because if you're having those questions, then more often than not, you're meeting a clinical condition here. Let's talk about anxiety. So, pretty much, if this is something persistent, so more often than not, for 2 weeks or more, then perhaps you can meet the diagnostic criteria for an anxiety condition. So when that happens, it does make sense to really first seek consultation with a mental health provider. Again, it could be therapy, and there are many individuals out there that choose to work with a psychiatrist as opposed to therapy or both. Again, I could have so many videos on this alone. So really, to summarize, it's really the chronicity of symptoms is one of the first things to keep in mind whether we really need to work with a mental health provider. The other important factor to consider is if any of these symptoms are so severe enough. So we're talking about the intensity of the experience that it really is impacting important parts of your life, including work. So, for example, is your work performance really declining because of these symptoms? We're also going to take a look at relationships. Are relationships being impacted because of isolation, because of anger, irritability, and so forth? How is it interfering, if applicable, if you're in school? So, again, you're accustomed to really achieving at a certain level, and for whatever reason, yeah, performance is declining. So, again, we're looking at the chronicity and the severity of symptoms, and then also, is it impacting a very important aspect of one's life? So that's the therapy piece of it. So, what coaching is appropriate for is when there aren't these clinical conditions that are causing significant impairment or dysfunction in important areas of one's life. So, coaching is absolutely appropriate if you have already done the treatment for severe burnout leading to depression, anxiety, and so forth, and you're really wanting to think about, okay, I feel so much better, but I still have things to figure out as far as career goals, personal life goals. Perhaps I want to just clarify what I really, really like. So, clarifying values and what are my passions and my interests. So, in many respects, if we were to do like a quick summary, right? Therapy is really for healing, and coaching is here for forward movement after the healing and recovery has been done. So, again, this is really an oversimplification, but my hope here is to just clear these very muddy waters about where do I really start and who do I connect with first. So, my last comment is, when does it make sense to work with both a therapist and a coach? So, it really depends on many factors here. So, one rule of thumb, as far as what I'm always thinking about, because by the way, I still have a small therapy practice in addition to my coaching practice. So, I'm thinking about this all the time. So let's say the person is in therapy and the symptom severity is no longer in the severe range. So, for example, let's say sleeping is better, and yes, thumbs up. So let's say sleeping is better, mood has significantly improved as compared to the start of the work in therapy. This is when a coaching experience might be beneficial, right? Because now we're feeling the relief and the lifting of the heaviness of what depression and anxiety are, that now we can start thinking about future momentum here. It might also be a great idea, as you're completing the work of therapy, to align yourself with a coach, because it's pretty self-explanatory that our work does not end when the work of therapy is done. We still have goals, we still have things that we want to achieve. And so, again, this is when coaching might be appropriate as therapy is phasing out. So these are just a couple of examples. Again, if you have more questions, just drop it in the chat, and then I'll make sure to record additional videos in the future talking a bit more about this. Because these are important decisions, and there's so many options out there that it can be stressful alone just to figure out who do I best connect with. So, those are just some things to consider as you're thinking about working with someone to help you recover from symptoms that are really impacting your day to day functioning, impacting just major aspects of your life, versus wanting to really focus on the future, if you're not experiencing, again, the heaviness of things like depression and anxiety. So that's all for today. Again, drop any questions, comments, thumbs up this video if this resonated or if this was helpful for you, and make sure to subscribe to this channel. Thank you, and I'll see you soon.